So here's an interesting exercise you can undertake. Look from the time of injury, calculate in the medical records when the first time the person actually gets any type of medical relief, any type of anything, pain reliever or anesthesia, anything that will stop the pain. You will find sometimes it'll be 24 hours because of differential diagnosis. Pain is an important part of differential diagnosis, so doctors make absolutely no effort to stop pain. They need the pain to help them diagnose what's wrong with you. So you have all sorts of pain and mental anguish evidence from that type of proof. The differential diagnosis itself, a lot of times the testing is very painful, the type of testing they have to do. Another thing is a very important point, your major versus your minor injuries. When we have a serious injury, like a paraplegic, for example, we may ignore the other injuries that the person has, so we're so thoroughly focused on the big injury. What I do in that case, and this is an exercise I've been doing for a very long time, I'll take a paralytic, and I'll take the paraplegia case, and I'll tell one of my associates, okay, you forget about paraplegia. You take this person and go analyze every other injury they have and analyze their entire case in the absence of paraplegia. And you'll find a lot of damages there that are all added up and cumulative with the paralytic damage. There are all sorts of damages involved in treatment and therapy. Between therapy treatments, patient decision making is I had an 18-wheeler driver who was given eight hours to decide, come back the next morning for surgery. He's in his hospital room, the doctor's coming back, he says, by tomorrow morning I have to know if you're willing, if you want to have an amputation or risk death. And so that's a very long night. Informed consent, some of the things contained in informed consent, that you may die, you may get AIDS if there's blood transfusion, all the things in the informed consent that they have to sign cause mental anguish. All kinds of testing, surgery, post-operative, recovery period, prosthetic. You get a lot of times your rehabilitation therapists are very, very good witnesses on mental anguish. Physical pain, obviously, but there's a lot of mental anguish in learning to walk again when you've had a leg amputation. So these people make very good witnesses.